It's little details like that that make the difference in your results as a therapist. Now we will treat the anterior deltoid and the long head of the bicep. In Hoshino Therapy, we have a special hand technique for the safety of the therapist's hands and also for the comfort of the client. We never approach with pointy fingers or pointy thumb. We always use a whole hand and then we apply the pressure. This makes it a lot more comfortable for the patient when you have to work on areas that are very sensitive and inflamed. Also, I cover more surface area, I compress more muscle tissue and lymphatic and circulation, as well as I warm up the area with the heat from my hands. There's a lot more heat if I have my whole hand applied than if I just have a couple thumbs and fingers. Moving on to the brachialis, which all these muscles I find have lots of adhesions. And I'm comparing it with what I found on the right side and using the right side as my guide as to where this stuff should be and the proper tension and balance between both shoulders and the neck and the pectoral girdle. I look for balance and symmetry and muscle tone. I want to see as even a balance and symmetry and muscle tone and spinal alignment from left to right as I can maintain. Now here is a very important area for the insertion of the triceps, short head and long head, and the middle head. These attach on the back of the scapula and work with the levator scapula and control the position and angle of that upper back part of the neck. So if I find a tricep in spasm, I know that I have to release this in order to get a very good result up here. So we are actually working on the neck by working on the tricep. So a lot can be done even if a person has an acute whiplash or a herniation in their neck. You never actually have to touch it to treat it. And that is one of the keys to our therapy with working with acute injuries. Which the most important thing is not to make it worse, not to aggravate the injury, and yet relieve the pressure on the spine so that the person can recover quicker. Now moving on to the flexors of the forearm. And here I find that same tension that is coming through the thoracic outlet and the cervical spine, because as those nerves get compressed, it causes an involuntary muscle contraction throughout the whole thoracic outlet, which then travels down all the way into the hand and even the fingers. So when you find these reflex points in the hand, you can actually relieve different points on the neck by working as far down as the hand and forearm. Here I find part of that entrapped nerve in C2 and C3. I know this from experience. And the pressure here, on a scale of 1 to 10, if I had an average arm here, I would expect to find a pressure of 3 or 4, even 5 would be normal. Hers right here is up on 8 and 9. So I want to always check these points and make sure that I see a reduction in the pressure and the sensitivity. And that will then let me know that my work has been successful. If I do not see these changes in the pressure points, then I know that my evaluation has to be reassessed and my approach has to be reevaluated so that I start to make progress. This is our focus as a therapist and a result-oriented therapy. If we do not get results, then we are not accomplishing our goal. So we want to always see progress, and that lets us know that we are doing the right thing for the problem. We do not want to rely just on our intuition or our past experiences, because each person can be uniquely different, even though they have the same injury.